Health Check with Nurse Jenn is presented by Island Cancer Center.
Today, I'm Nurse Jenn. Anemia is the most common blood disorder in the general population today. It affects more than 3 million Americans and an estimated 1 billion people globally. Anemia is a condition that occurs from an abnormally low number of red blood cells that leads to reduced oxygen and nutrients to the body. It can be caused by numerous issues, including blood loss from hemorrhaging, heavy menstrual bleeding, nutritional deficiencies, and chronic disease. The most common type of anemia is known as iron deficiency anemia. Blood loss can be acute or chronic from surgery, childbirth, a car accident, trauma, cancer, and abnormally heavy menstrual cycle. The good news is that today there is a wide range of treatment options for anemia. All aim to increase the red blood cell count, ultimately increasing the amount of oxygen in your body's bloodstream. Anemia treatments can include over-the-counter iron and folic acid supplements, B12 shots, blood transfusion, oxygen therapy, and IV fluids. Vegetarian diets heed caution, as this type of diet could lead to risk for iron deficiency anemia, but can easily be avoided if the vegetarian supplements their diet with green leafy veggies, dried beans, whole grains, fruits, and milk fortified with vitamin B12. How can you determine if your own self is anemic? Symptoms include unexplained bouts of fatigue, decreased activity tolerance, shortness of breath, pale skin, and sometimes heart palpitations with a rapid heartbeat. Diagnosis starts in the doctor's office with a simple blood test known as a complete blood count, a CBC, to test your hemoglobin, hematocrit, and red blood cell counts. A CBC can give an indication of the person's overall health and wellness, and underlying chronic disease such as leukemia or kidney disease are developing. The outlook for a person with anemia depends on the cause, but many can be prevented or solved with diet changes. However, some types can last a long time and some can be life-threatening without treatment. If you persistently feel weak, fatigued, tired, and have difficulty breathing, it's important to see your doctor to get checked out for anemia. I'm Nurse Jan reminding you, don't wreck yourself, health check yourself.
Health Check with Nurse Jenn is presented by Island Cancer Center.